Good morning. The question asked to me was, what impact does osseous versus hematogenous extramedullary multiple myeloma have on patient outcomes? First of all, I would like to appreciate the question and to describe first extramedullary multiple myeloma, or EMD, is when the subclonal plasma cells can grow outside the marrow, and it can be classified as bone-associated EMD or osseous extramedullary multiple myeloma, which is a soft tissue mass arising from bone lesions and growing contiguously. And the other option will be bone-independent EMD, which can also be described as hematogenous, which is an isolated extraosseous plasma cell tumor, which is not contiguous to a bone lesion. And these two are very important because there are up to 13% of patients with multiple myeloma may have it at diagnosis, which will be like around 7% depending on where you read it, and 6 to 20% at relapse. The importance of this, first of all, is that each diagnosis has been associated with people with bone-associated EMD with a higher median age versus those with bone-independent or hematogenous extramedullary multiple myeloma. And secondly, because it's normally associated with a poor prognosis, a high mortality, and an average overall survival in some reports of 36 months. Also, besides the presence of EMD, which is associated with a poor prognosis, there are other factors associated with this disease, like the presence of EMD at relapse, the presence of bone-independent or osseous EMD, the presence of multiple organ involvement or central nervous system involvement, and the absence of autologous stem cell transplant as a treatment. And this is important for us, especially as was reported in EHA 2023 by Dr. Llorente, because our tertiary referral center in Mexico City, we have a higher rate of incidence at diagnosis in overall at 22%, which will be around 50 patients of our 301 at diagnosis and relapse osseous involvement, and 29% will be 19 patients with hematogenous involvement. We also had these 4 patients, we had both of them, and well, at our report, it was a lower median overall survival with 52 months with patients with osseous or bone-associated EMD, and those with hematogenous or bone-independent with 32.7 months in overall survival, and also a lower progression-free survival. We have this importance, especially at our country, which could be classified as a middle-income country. First of all, because of a maybe higher incidence, which be explained first as a problem in referral which was delayed by difficult problems we have over here, or also which might be interesting to look up in the future because of a more aggressive disease. And second of all, because normally less access to autologous stem cell transplant is associated with a worse prognosis, and our country and most of the countries with lower and middle income are associated with a lower rate of autologous stem cell transplant, which could also explain the worst prognosis in our patients. So this will be like a key points to address, like in summing it up in the question. Well, the presence of osseous and hematogenous extramedullary multiple myeloma is of a worse outcome, is associated with a worse outcome, and especially those with bone independent and hematogenous independent EMD.